price? How easy is it to scale up? There are some platforms, some technologies which are much easier to make in bulk than others. So that could be a criteria. The storage conditions, do you need a -20 or a -80, or can you store the vaccine at 2 to 8 degrees, which of course makes it much simpler for use in many countries. And so there will be these criteria that this committee will look at and advise Gavi on where those investments must go. And again, initially, there may be limited choice. There may be 1, 2, or 3 vaccines that are approved. But as time goes on, hopefully there will be more choice. There will be also a possibility to choose certain candidates for certain settings or certain age groups, etc. So as time goes on, I think this will be changing. But at the moment, it's going to be based on a clear set of criteria, and will be decided not by 1 or 2 people, but by an independent international expert advisory group that's now being set up exactly to advise on this.
Thank you very much. Viewers are always interested when an efficient vaccine will be available, and once we have it, if we have it, how it will be distributed equally, how it will come to the people who need to receive it first, as we are aware that we won't have enough doses at the beginning for everyone.
Yeah, that's a great question, because, I think many people think of the vaccine as a silver bullet that will arrive on the 1st of January and that will basically solve the world's problems. It's not going to work like that. We will start seeing the results of some of the trials, which are already now in phase 3, the advanced stage of the trials, by the end of this year or early in 2021. Then, it has to go through this process of evaluation and licensing. And then the scale-up has to happen, the manufacturing, the shipping of the doses. We're looking at the middle of 2021, an optimistic scenario for a limited dose of vaccines to arrive in countries. And this is where the allocation framework that Mariângela has been leading is very important, because I think countries and people need to recognize that the first doses of vaccine that become available, we must prioritize to whom that goes. The people who are at highest risk of getting the infection. And most people agree that frontline workers, including health workers and other essential workers, are those that might be the ones who first should get these vaccines. And then gradually, as you get more doses, you start covering the population. You first cover those who are at high risk, the elderly, those who have other diseases, which makes them at high risk, etc. Slowly, you start covering more and more of the population. That's going to take a couple of years. And before that, we need to continue the public health measures that we have shown to be effective now. So it's really important, I think, for people to know that when vaccines come, they will take time to be scaled up till everyone in the population, or at least till 60 or 70% of people get that immunity, which we talk about, the population or the herd immunity, which can really slow down transmission. We're not talking about eradicating the virus here. We're talking about reducing the kind of impact that it's currently having on society, on lives. And so that's going to take certainly up to 2022, to see that change happen. Until then, people have to be disciplined. I think that's really the only solution going forward.
Thank you very much, Dr.
Comment here very quickly, because I saw some questions on herd immunity on the chat on the side here. And I think there's a lot of misconception about herd immunity as well, because herd immunity is a term that's used to always referring to achieved by vaccine. It's not by immunization. And herd immunity to be achieved by natural infection, in the case of this SARS-CoV-2, would mean herd immunity without a huge life costs, without a vaccine. Okay, so when you're talking about herd immunity, we are talking in the context of immunization, not in the context.
That clarification. we spoke about vaccines, we spoke about therapeutics, but we also have a pillar on diagnostics. So our viewers are asking, are there available and accessible quality tests, and what's the status of, do we have maybe some new diagnostics in pipeline?
There's a lot of innovation and also antibody tests, which tell you whether you've been exposed to the virus at some point. So the antibody tests are more useful for PCR tests and the antigen tests. And there's been a lot of progress. The price is coming down. It is possible that very soon we will have these tests available, even the paper-based tests, that people could even use for self-testing at home. And then it could have mass testing, where people are congregating or going to work and so on. And so I think the way we approach testing and our strategy is also changing and will change as these become available. So it's a very good. There's a much better chance that you can provide them the suitable care, monitor them, and prevent them from deteriorating and getting into severe problems. And that's one of hospitals. Today it's the reverse. There's two things. One, it makes sure that you don't get sick because you're doing the right things that are doctor monitored. Really important field, and definitely something that the ACT-Accelerator has been discussing a lot and putting a lot of thinking into.
Thank you very much, Dr. Soumya. Dr. Mariângela, do you have anything to add to this one?
No. Good. Thank you.
Thank you very much. We are running out of time. I thank all our viewers for their great questions and for watching us from Scotland, Uganda, Canada, Nepal, Papua New Guinea, Bangladesh, Tanzania, the US, Haiti, South Africa, Vietnam, Thailand, Myanmar, Cambodia, Nigeria, France, Poland, India, Armenia, Turkey, Iran, Singapore, Sudan, Pakistan, and many more. I thank Dr. Soumya and Dr. Mariângela for their time and for taking all these great questions. Please follow our website or our social media channels for any updates on vaccines, therapeutics, diagnostics, and any other work that we are doing on COVID-19. Until next Wednesday, please stay safe.